doctor's orders, and I have gathered my supplies, and I've come into the room. Hi, my name is Laura, I'm a nurse. The doctor's ordered that we insert a nasogastric tube. That's where I'm gonna put a tube into your nose that goes to your stomach. Is that okay with you?
Yep.
Do you have any questions?
No.
Right, what is your name and date of birth?
Neil Nelson, 1983.
I'm also gonna check his wristband. I have washed my hands and provided privacy. Now, I've checked his medical record to see if he had any past facial traumas or surgeries. He has not. I'm also going to ask him, have you had a broken nose in the past or any facial surgeries?
Nope.
No. How about sinus issues?
Nope.
Recent bloody noses?
Mm-mm.
All right. I'm going to check the patency to see if the tube will go in, if there's nothing obstructing it. There's not. Going to give you an emesis basin. If at any time you feel like you need to spit or throw up, that's right there for you. And here's some tissue. And here's a glass of water. For when I insert the tube, I'm going to have you swallow when I say swallow.
Okay.
Next, I'm going to open up the nasogastric tube. And I'm going to measure, which will be from the tip of the nose to the earlobe to the xiphoid process. I'm going to mark that with a piece of tape. Next, I'm going to open up a water-based lube, and I'm going to squirt it out onto the container that the nasogastric tube came in. And if at any time while I do this, if you feel any discomfort or pain, please let me know.
Okay.
And by raising your hand, and I'll stop.
Okay.
I'm going to take the tube and try to curl it so it has an arc. Coat the 4 inches, the last 4 inches in the lubricant. I'm going to insert it and then hold it when it's about 4 inches in. Are you doing okay?
Mm-hmm.
Okay. Next, I'm going to have you swallow water, and every time you swallow, I'm going to advance the tube a little bit more. So, swallow, 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 swallow. Great, you can stop. Now the tube right to where I marked it. I'm going to take this piece of tape that's split down the middle and take one side of it just to secure the tube in place while I check placement. You can put the water down. Right, I'm going to open your mouth. I'm going to check to see if there's any coils or kinks or if the tube looks like it's pushed up a little bit, and it doesn't. So I'm going to check to make sure that the tube is placed correctly in the stomach. What I'm going to do is insert 5 to 10 cc's of air into the tube while listening at the fundus of the stomach right to the side of the xiphoid process. I inserted the air and I heard a swoosh. So that means it's correctly placed, but I'm also going to aspirate five to 10 cc's of stomach contents, put it in my cup, take a pH strip and test it just to confirm placement. And if it's between 0 and 4 on the pH scale, then we are in the stomach, and it is. So, since it is properly placed, I'm going to go ahead and secure the other side of the tape. I'll take this piece of tape, just wrap it here, and I'll pin it to his hospital gown. Enough so he can move his head around, but if this gets tugged on, it's not going to come out of his nose. Then I'm going to hook it up to the suction, turn the suction on, then take 5 to 10 cc's into the blue tube and insert that. And what that will do is that will lift this off the stomach wall, because when it suctions, it has a tendency to stick to the wall of the stomach. All right, blue to blue, and the suction is going. Are you okay?
Yep.
All right, I'll put this call light in place, and I'll come back and check on you if you need anything.
Thank you very much.
So I come back in a few minutes, and I notice the suctioning has stopped. So I turn it off. I want to check to make sure this is placed correctly. So I disconnect the suction. What I'm going to do is listen for the swish of air to see if it's properly placed. Okay, I can't press the air in, so I'll try aspirating some stomach contents. Pull that out, can't aspirate any stomach contents. Most likely means it's occluded. So what I'm going to do is I'm going to take my syringe, fill it up with 30 cc's of water, and I'm going to pump this in an attempt to dislodge that occlusion. Okay, so it went through. Once again, I'm going to take 5 to 10 cc's of air, now that it's dislodged and patent, and listen for placement. Okay, I heard the swish of air. And just to double check, we're going to take out the stomach contents. Put it in my cup. pH test between 0 and 4 on the pH scale, so we're in the stomach. Then I will hook it back up to suction, turn my suction on, take a new syringe, and insert another 5 to 10 cc's of air into the blue pump, because now the suction's going, I want to lift the tip of the NG tube off the side of the stomach wall. Done that, blue to blue, back together. Are you doing okay?
Yes.
Okay, here's your call light. If you
Thank
need
you.
anything, let me know. Okay, so some time has passed, and the doctor has discontinued the nasogastric tube. So I come in here, verifying the orders, identified my patient with 2 identificators, and then I turn off the suction, disconnect this, and what I want to do is check placement, because I'm going to flush the nasogastric tube with water and air to get all the bile out of there before I pull it out. So I'm going to take 5 cc's of air, but before I do that, I'm going to make sure that there's gastric sounds, that there's bowel sounds in all 4 quadrants. And there's bowel sounds in all 4 quadrants. So I'm going to take my syringe, insert the air, I heard the swoosh, and again to double check, let's pull out those gastric contents and do a pH test to verify that it's in the correct place. pH strip 0 to 4, we're in a correct place. So what I'm going to do is take a new syringe, fill it up with 20 cc's of water, and then 20 cc's of air. I'm going to hold this upright so the water goes in first, followed by the air. The water will flush out the bile and the air will flush out the water. So I insert that, disconnect from his hospital gown. Okay, I'm gonna take this out. When I do this, I want you to take a deep breath in and hold your breath, and then I'll pull it out.
Okay.
Are you ready?
Yep.
Okay, on 3, we'll take a deep breath in. 1, 2, 3. And hold it. Now pull this out. And I'd have emesis basin and tissue here in case he feels like he needs to throw up and he wants to wipe his nose or anything. How are you doing?
Good.
That's good. Okay, the call light is in place. He has water. Is there anything else I can get for you?
Not right now.
Okay, and I'm gonna have you remain upright in this 30-degree position for a little bit longer.
Okay.
Is that okay with you?
Mhm.
All right. And then I would document.